There's nothing I like better than a good story. The stories that our patients have in the ER are the best stories ever. They're interesting, they're full of human drama and possibility and hope, and that's why our patients come to us. So that's why I got interested in listening to patients at the bedside, and I realized that being present and listening to those stories also really helped me do a better job taking care of patients medically. Knowing where they're coming from, how they got where they are, and where they want to go helps me make the best decisions with them for their care. And that's how I got interested in the patient experience at the bedside, is really through those stories. One of the areas that I work on for EPMG is to do didactic sessions at our sites on patient-provider relationships. As well as didactics, we do coaching, and the coaching is bedside observation. So we watch our providers at the bedside with patients, observe what they're doing, record what they're doing, and give them feedback on the specific skills that they're showing. And then we also offer some suggestions. Difficulties with patient relationship at the bedside fall into two basic categories. The first category is a skill deficit, and it's actually less common. The other category is a little trickier, and that has to do with engagement and burnout. The work of a provider at the bedside is so emotionally and intellectually taxing that if you're not 100% present at that moment and engaged in what you're doing, the patient knows, and it degrades that relationship and that experience. So really the second part of what we do is helping providers to realize that their engagement in the moment with the patient is the most important thing. So I think it's important to understand for our providers that what works best for me may not be what works best for everyone. There's some things that we know are important to do. It's important to sit down. It's also important to let the patient talk. So the average amount of time a provider lets a patient talk after asking an open-ended question is about 9 seconds. If you let that increase to 45 seconds, it makes a huge difference in how the patient feels listened to. So there are basic things that everyone can do, but the way you do them needs to be individualized by provider. So what I do is I work with providers to help those things seem natural to them. I think the person who most benefits is the patient, because they're coming to us at their most vulnerable time, asking us for help. And if they can really feel cared for and know that we're going to do our best to take care of them, they're going to feel most comfortable and they're going to be able to benefit from the care we provide.